Fibromyalgia. Is it actually all just in your head? Well, that's what some people would like to tell you, but the truth is definitely not. Today's video, we're going to be talking about a condition that is often poorly understood, can be stigmatized, and can be a challenge to diagnose. Increasingly, it's a condition that rheumatologists are seeing less, partly because of pressures on the front door, and we're asking other specialists to support. But I do think there's some difficulties with that because fibromyalgia can coexist with other inflammatory conditions, and many other specialists don't feel they have the expertise to rule out those inflammatory conditions or provide the right kind of support for patients with fibromyalgia. Okay, so let's start off by just laying out the basics. What exactly is fibromyalgia and what does it entail? Fibromyalgia is a chronic pain condition, but it's a bit more than just chronic pain. I would characterize it as a nervous system functional impairment. That is to say that there's a change to the way that your brain is functioning. We don't think about it quite like an organic condition. Organic conditions being ones that are categorized as very obvious disease processes going on, like a tumor in the brain or inflammation of the brain or infection. But that's partly because we don't fully understand what's going on in fibromyalgia. The kinds of things that people with fibromyalgia suffer are chronic, widespread pain. So this is pain that often starts around the trunk, so it's often around the neck, back, but it can be anywhere, upper shoulders, upper thighs, hands. It's not confined to the joints, nor confined to the muscles. Everyone has a slightly different pattern. Often that pain is worse if you're fatigued, if you've ever done things, or in the evenings, but the pain can wax and wane as well. So you may have periods where things are better and periods where things are worse. Alongside that pain comes some cognitive disturbances. This is things like brain fog, word finding difficulty, short-term memory issues, just inability to concentrate. And that might be caused by the fact there's often, and usually in fact, coexisting sleep impairment. So sleep is not as refreshing as it should be. Again, this is not uniform. Some people get off to sleep, but they just don't stay asleep when they wake up. Others seem to have a good quantity of sleep, but the quality of the sleep they have just doesn't allow them to wake up feeling refreshed in the morning. And some, of course, have both a reduced quantity and a reduced quality of sleep. Tie all this in together, and you do sometimes see that patients with fibromyalgia have other problems that might be mood disturbances, whether that is causing or exacerbated by fibromyalgia. Things like anxiety and depression are quite common. And then other issues with functional impairment of other organs, migraines, persistent headaches, and irritable bowel, restless legs. These are all things that may coexist. What exactly is happening? Truth be told, we don't properly know. What we do know is that this probably comes on over time. In some, it seems to be triggered more rapidly than others, and there may have been a trigger. The trigger might be a major physical insult, a major illness, car accident, serious hospital admission, or potentially a major psychological trauma, a death, a bereavement, or maybe abuse in the past. Sometimes it's a collection of lots of small traumas over time, and in some patients it's not really easy to predetermine there was an onset at all. It just seemed to come on. There's a chicken and egg argument as to whether sleep is the first thing or pain is the first thing, but probably sleep disturbances lead to the nervous system not properly being able to reset itself with the function of sleep. That leads to changes in how the brain works and the development of what is called nociplastic pain. The brain is spending more energy and more of its resources and area focused on stimulus from the body and interpreting that stimulus as painful. So that when you knock yourself, it hurts a lot, and even things that shouldn't hurt a lot. But you can also become sensitized to non-painful stimuli, being sensitive to loud sounds, being sensitive to bright lights. As this goes on, it starts to impact your quality of life. It may make it difficult to have normal relationships, normal employment. And although there's a tendency to think if I did less activity, that'll help me, although that does short term, in the long term, people lose their resilience and reserve, and it spirals out of control. Brain chemicals may be involved, like serotonin and noradrenaline, but that isn't the whole picture. So what do you do? Well, if you do have symptoms of fibromyalgia, you're going to see a rheumatologist who's going to take a full history. There's no one specific test that's going to show you're fibromyalgia positive, but there are many things they might want to consider. Chronic illnesses like thyroid disease and diabetes can mimic things like fibromyalgia symptoms. And of course, you may have some inflammatory arthritis symptoms that need investigating. If you do get a diagnosis of fibromyalgia, we start by giving you the best support and education, online resources, booklets, support groups, education packages to understand fibromyalgia and how these cycles affect you and what you can do to limit those impacts and manage your symptoms is really important. Physical strategies in retraining your body with physiotherapy, hydrotherapy, and graded interventions helps you to regain some energy and not overexert yourself. And cognitive and psychosocial strategies like mindfulness-based cognitive behavioral therapy, meditation, sometimes counseling, and social interventions are helpful. Medications can play a role here. They can help you get off to sleep with drugs like tricyclic drugs like amitriptyline and nortriptyline. SNRI class drugs like duloxetine may help rise chemicals in the brain that are associated both with pain but also mood disturbances, and occasionally GABA-based drugs can be useful. So, note, fibromyalgia is not all in your head. Yes, we have found definite differences. Sadly, most of these changes we've seen in the research setting have not translated into a specific fibromyalgia test. The good news, though, is if you do get this diagnosed early, put in place a comprehensive care strategy, that it is possible to live a good life despite suffering from fibromyalgia. If you've got any thoughts, comments, suggestions, I'd love to hear them below. If you find this video helpful, do consider subscribing because it helps the channel's visibility. Thanks.